Let's dig deeper into the health aspect of all of this and bring in Dr. Robert Davidson. He's an emergency room physician out of Western Michigan. He's also the executive director of the Committee to Protect Medicare. Doctor, I want to get your first reaction to these states that are reopening the economies. There are some that are arguing they may only have 100 or 200 deaths. They need to do this economically.
Yeah, it's highly concerning. The president's own task force laid out a framework of a plan. I hesitate to call it a plan because it didn't include how we're going to test more people. But within that framework, it said we needed 14 days of decreasing cases based on symptoms and based on widespread testing. There is no way that these states, I think we've just said that in New York, they still don't have enough testing. I know here in Michigan, we don't have enough testing. And I don't understand how Georgia or Texas could say they've had 2 weeks of decreasing cases just because they only have 100 or so deaths. That is a 2 to 3 or more week lagging indicator of how many cases are out there. And I just think we're going to see more hotspots pop up in those states. And when people travel from those states around the country and to my state of Michigan, we're going to see more cases elsewhere.
Now that some hospitals that were overtaxed are saying they're managing the situation, there are some who say you cannot stop this thing. We're not getting a vaccine in the next few months, but at this point we could manage it, and the economic toll is possibly bigger than the health risk. What do you say to those people?
Well, when I'm working in the ER, I see that on the faces of my patients. I see the anxiety about the economy, but I also see a significant anxiety about the virus and about the disease itself. And the fact that we are managing this at hospitals all over is evidence that shelter in place has worked. It's as if, you have an infection, they prescribe you an antibiotic and you get better. We tell you take it until it's gone or it's going to come back worse and then we're not going to be able to treat it. It's just, again, I think it's very short-sighted and it's going to result in a longer-term health and economic crisis.
I want to talk about your state specifically because you've got Ohio and Indiana on your southern border, and those are two states that are talking about starting to reopen May 1st. How worried are you for yourself and your fellow colleagues? You are healthcare workers that are at risk.
Well, with our committee, I have doctors all over the country, so I'm worried about every state for their own sake, but certainly on states that border us, and we have interstate commerce and, families that have loved ones across state borders. This virus doesn't understand what state starts and what state ends. This is why I have been calling, and our committee has been calling for a national response, national testing, supply chain enhancement by the Defense Production Act. And, I worry that things might seem okay for a few weeks, and 3 or 4 weeks down the road, as those cases turn into hospitalizations, turn into deaths, we're going to realize that we didn't use the data and the science that we should have.
What are your most realistic? I know what we should have. I know what we hope to have. But as far as testing goes, where should our immediate focus be? What's needed most right now?
I think we need to continue now testing symptomatic people. We just started 4 days ago now in Michigan being able to test every single person with symptoms. We need to have staff that can do contact tracing so they can identify everyone that they've been in contact with within reason, even maybe 75% of the people they've been in contact with, test, the majority of those people and or quarantine those people. And then, everyone else, I think we can start to slowly unroll and get people back into the economy in safe ways. Some of the businesses you said were opening in Georgia, that terrifies me that those very close proximity type occupations, I realize they can't work from home. But again, if we don't use the data, this short-term economic crisis we've seen will have all been for naught because it's going to turn into longer and longer term crises.
Tell me how you and your fellow doctors and nurses and hospital staff are doing. Even in the last few days, we hear more and more stories about private practices that wanted to go out and apply for the small business loan because that's what a doctor's office is, and they couldn't because they were working. People who haven't been able to pay their rent or their taxes or even see some of their kids. What's going on?
Well, I think, I'm a hospital-based specialty, so I'm working. My staff is all working. And so in that respect, from an economic standpoint, we're very lucky. We're able to continue doing what we've been doing, what I've been doing for 2 decades. I think the bigger concern when I talk to my staff, especially people making $16, $17 an hour, nurse assistants and people, cleaning crews, is the health aspect. They're worried about the protesters in Michigan and the president, tweeting his support of them, causing an increase in cases and putting them at higher risk so that maybe they won't be able to provide for their families. And so that, to me, is the number one issue on people's minds. It's just always kind of underlying every interaction we have at the hospital as we're trying to maintain distance between ourselves and keep ourselves safe.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.